Cast is now starting. All attendees are in listen-only mode.
Good afternoon. Thank you for joining us. We're going to give everyone just a few more moments to hop on the webinar. Thank you. Good afternoon, and thank you for joining us. I'm Courtney Washington, the Program Manager at Clear Impact. Today we'll be joined by Dietrich Epp, Partner and Senior Consultant at Clear Impact. At Clear Impact, we provide performance management software training and services to help government agencies, nonprofits, communities, and foundations track the performance of their programs, measure the impact of their funding, and report on the progress of their mission to improve the lives of children, families, and communities worldwide. Just a little bit of background about our presenter, Dietrich Epps. Dietrich Epps is a partner and senior consultant at Clear Impact. Ms. Epps provides RBA consulting, training, technical assistance, as well as coaches, executive, and senior staff to achieve organizational and community results. Some of Ms. Epps facilitates data-driven meetings for organizations and communities. Some of her clients include local, state, and federal government, community-based organizations, including nonprofits, foundations, and philanthropic organizations. Ms. Epps has a BS in microbiology, MS in human service administration, and works with clients nationally and internationally to achieve equitable outcomes in health, education, child welfare, juvenile justice, and homelessness. We will also be joined by Eileen Fenn, Director of Operations, who will help moderate this session. Today's topic will be achieving equitable outcomes with results-based accountability. Questions can be asked to the presenter by typing your questions in the questions box. Questions will be answered at the end. Lastly, at the conclusion of the webinar, you will receive a survey. That survey will provide you an opportunity to provide feedback on your webinar experience. Also, completing that survey will allow you access to the recording as well as access to the webinar slides. I will now pass it over to our presenter, Dietrich Epps.
Hello, everyone, and I welcome you also to the webinar. I will share that we've had registrations from both across the United States as well as from Australia, Canada, and from also New Zealand, I believe, as well. So we have an international group joining today. The purpose of today's webinar is to support participants to move from talk to action towards achieving equitable outcomes with results-based accountability. Many of the participants, many of you may already have been introduced to results-based accountability, but I will take some time to do a brief overview of RBA, and the focus of our time, though, will be around looking at using a common language for equitable outcomes. We'll also take a look at what does it mean to consider equity and inclusion within the context of results-based accountability. We'll focus on RBA's turn the curve thinking and look at the implications for equitable outcomes that are inherent in the turn the curve thinking process. I'll share with you some approaches and resources that align with RBA and equitable outcomes, and we'll take a moment at the end to ask you for commitments to action and to next steps for continued conversations with us around this topic. We understand that there are various degrees of experience with RBA, as well as various degrees of experience with working with equitable outcomes. So during this webinar, I'll share with you a basic approach to bringing these two frameworks and concepts together. I'm inviting you also to join us in next month on November 8th to 10th, where we're having our Measurable Impact Conference, and the conference is taking place in San Antonio, Texas. At the last day, on that Friday, November the 10th, we'll actually have a racial equity community of practice. It's my hope that today's webinar will invite us all into a conversation that we continue as practitioners in the conferences to come, in our meetings to come, and in any opportunities that we have to join together to build on this work. Let's start by looking at using a common language for achieving equitable outcomes with RBA. Results-based accountability has a distinction from other frameworks in that we look at two levels of accountability when practicing in the field. The first level of accountability is population accountability, and performance accountability is the second area. These two areas of accountability look at the concepts that include a condition of well-being for children, adults, families, or communities. When considering this concept, we are referring to population accountability, and we'll use that throughout today's webinar. The term that we'll use to refer to a condition of well-being for children, adults, families, and communities is a population level result. So examples of results could be any of the ones that you see listed here. All children are born healthy. Others that are listed here, a clean environment, prosperous economy. You might also be working towards a specific result or results within your community. The second level of accountability is performance accountability. And within performance accountability, we do measure the well-being of clients. But with population accountability, we actually look at the measure that helps to quantify an achievement of a result at a population level. And we will call this measure an indicator. So at a population level, whether it be for a geographic region such as a city, a town, a nation, the way that you measure if you're achieving these results is by an indicator. We'll use that language today. And the examples that you see listed here, all children are born healthy, for example, how would you measure if you're achieving that result? One way of measuring that would be an indicator of the rate of low birth weight babies. You can see other examples of indicators listed here that are for each of the results above. The second level of accountability is performance accountability. And in performance accountability, we're looking at the concept that is any government system, organization, or program providing services and or resources to a set of customers. These customers, you can look at customers within the government, within a service system, within an agency, a division, or a program. So any of those areas that are servicing people and they're receiving those services, these are considered a part of performance accountability, looking at the performance of each of these areas. These areas might be the city of San Antonio, for example, which is a government entity. All of the other examples that you see listed here would be implementing services or providing services for a set of customers. The way that we would measure how well a program, agency, or service system is working would be referred to as a performance measure. So looking at these examples, the City of San Antonio, the Human Resources Division, from a large government agency down to the smallest of units, even within a waterway restoration program. The way that we would measure how these programs, agencies, or service systems is working would be by answering these types of questions, 3 types of questions. How much did we do? How well did we do it? Or is anyone better off? This last question, is anyone better off, is an example of a customer question that answers a customer result. What is the customer result that you're seeing after the services are performed? For much of today's conversation, we'll be focusing on equitable outcomes within population accountability. For the sake of time, we'll look at community well-being, a condition of well-being for children, adults, families, or communities, and equitable outcomes at that level. Also looking at a common language, we want to define equity using PolicyLink's definition for equity. PolicyLink is a national research and action institute that advances economic and social equity by lifting up what works. And we're embracing their definition because it is comprehensive of other definitions of equity that are in the field. The equity is the just and fair inclusion into a society in which all can participate, prosper, and reach their full potential. Another idea that we'll consider on today's webinar is the idea of inclusion. And inclusion is the degree to which diverse individuals are able to participate fully in the decision-making processes within an organization or within a group. A third term that we'll consider today is the term of diversity. So when looking at inclusion, referring to diverse individuals, diversity can be a range of characteristics such as race, nationality, ethnicity, gender identity, sexual orientation, disability, political views, or social class, anything that makes us different as humans. In addition to demographics, we're also including diversity as different perspectives, gifts, and learning and communication styles. So this broad definition of diversity is being embraced throughout this webinar and throughout our conversations. So I invite you to think about who are the populations that you serve and what is the diversity that exists within those groups. One area that we'll focus on for a moment is racial disparity. And racial disparity and the definitions that exist within racial disparity. As you can see from this slide, there are various systems that are noted on the left-hand side. Within each of these systems, you can see a disparity by race across the country, the United States of America, without exception. Which area do you represent? Where do you find yourself spending most of your time and most of your work effort? In the child welfare system, there is racial disparity, and it's using the term, oftentimes the term disproportionality is used within the child welfare system. And the definition of this refers to the proportion of ethnic or racial groups of children in child welfare compared to those groups in the general population. So racial disparity exists within the child welfare system. And you'll notice as you look through each of these systems, health, juvenile justice, education, special education, even there's a division within education and special education, and economic development. Within each of these systems, although all of them are looking at racial disparity, there isn't a common language that's typically used among each of the systems. So the terms disproportionality, health disparity, disproportionate minority contact, and achievement gap, disproportionate representation, historically underutilized businesses. By using several terms and by using different terms among these systems, it can lead to a lack of continuity and a lack of collaboration across these sectors, and also a lack of strategic planning amongst them. So you'll see that the definitions also differ when referring to the racial disparity. Today's webinar is about looking across systems and considering how can partners across sectors, multi-sectors, work together toward achieving equitable outcomes that brings the work together in a way that's addressing the issue itself, inequities. As these partners come together across sectors, it's important to include the individuals that are most impacted by the decision making. Let's talk for a moment about the importance of inclusion in achieving equitable outcomes. When looking across various sectors, I would like to share with you the 7 principles of leadership and inclusion of people with lived experience of homelessness. This example from Vancouver, Canada, speaks to engaging individuals with the lived experience throughout the process of decision making. The term "nothing about us without us" has been used for decades, and it has often been recently associated with the disability community. But these concepts can be applied to homelessness, to disability, and to every sector that you're working in to achieve equitable outcomes. These 7 principles can be applied, starting with bring the perspective of our lived experience to the forefront. Engage those individuals with the lived experience and bring that to the front of the conversation. Include people with the lived experience at all levels of organizations. So when working toward equitable outcomes, are individuals with the lived experience in leadership? Are they in power positions? And are they also providing direct services? Are they engaged at all levels of organizations as well as in the community? Value our time and provide adequate supports. This principle speaks to the common practice of engaging individuals with a lived experience and oftentimes giving stipends or perhaps incentives, but think about and consider the individuals who are in the room when decisions are being made and the salaries that are being paid. How can those individuals with the lived experience have the same value placed on their time and or have adequate supports to support their time that they're taking away from their day-to-day activities to be a part of the conversations? Challenge stigma, confront oppression, and promote dignity throughout all of the processes. Recognize our expertise and engage us in decision-making. Work together towards our equitable representation and build authentic relationships between people with and without the lived experience. These 7 principles actually embody what it takes to authentically include individuals with a lived experience. Remember, inclusion is the degree to which diverse individuals are able to participate fully in the decision-making processes within an organization or within a group. So looking at these 7 principles and applying each one of them to the work of collaborations, the work of organizations, and the work of community development will go far in helping to support equitable outcomes in whatever sector you're working in, or also working in multi-sector efforts. When bringing individuals with the lived experience and without the lived experience together, it's important to engage in meaningful conversations. And these meaningful conversations take part through dialogue. Take time to listen and understand the information that's being shared. Inquire if there's something that happens that you don't understand, or even that you are having a reaction to. Take time to ask clarifying questions. Suspend judgment and be open to new ideas and possibilities that may not have come up before, or even if they have come up before, be open to ideas, to revisiting ideas. Also, take time to explore assumptions. Surface thoughts about the directions things are headed and why. Start with questions and be open to the responses that may or may not be different than what you currently think or believe. So let's take a moment and have a virtual chat. This is a little bit of the community of practice engagement that I'd like to invite you to. I'm going to ask a question. How can we build the capacity of local residents and those impacted by the strategies to engage in meaningful dialogue as equal partners? In your chat box, you can take a moment, put what your thoughts are about that question. What have you used in your community that has been effective in engaging local residents and those impacted by the strategies to engage in meaningful dialogue as equal partners? We won't take time to share this now, but in a few moments, we're going to come back and revisit the things that you've placed in that chat box and learn from each other, even in this webinar. I'll give you a moment to respond. Let's take a moment and talk about turn the curve thinking. Turn the curve thinking is the core process within results-based accountability, and it enables groups and individuals to move from talk to action in a short period of time. This webinar, we're going to walk through turn the curve thinking, and I'm going to ask you at the end to think about some actions that you can take to move forward toward equitable outcomes within your organization or within your communities. So let's look at what turn the curve thinking is. Turn the curve thinking is a disciplined approach to decision making, and it starts with the data. And the data is written in a line graph format, and it's a very simple illustration that most can see where the line is going, up or down or plateauing, and it answers the question, how are we doing? The first disciplined approach to decision making is answering, how are we doing? And the second question that you want to think about is, why does the data look the way that it does? And where are we headed if we do nothing different in the near future? The next, and is that okay? You want to ask yourself, is that okay where we're headed in the next year or the next 2 or 3 years? And if it's not okay, who can help? What are some options that we have to actually address what we found out by asking the question, why? And once we think about who can help and the options that we have, what are we actually going to do amongst those options that we have? What are we actually going to do and take action around? Once you take those actions, you go back to that first question to ask yourself, after we take the actions, how are we doing now? Look back at the data and to see if there's been progress or not. And this is an iterative process that you continue over time. As you continue it over time and you look at the data to see if it's going in the trending in the direction that you want it to go, we call that turn the curve decision making. Look again, it's an iterative process. When you walk through the process again, did you improve from the last time you looked at the data? This turn the curve thinking is a decision making process that actually starts with the end result that you want and works backwards to the means. So that end result, how are we doing? Asking yourself why, and what are we going to do? The end result is that improvement in the data. What is the result that you want to see happen? And then working backwards to the means by which you're going to take action to achieve it. Ends to means decision making. There are 5 core questions in the turn the curve thinking that are based upon those concepts that I just shared with you. The 5 core questions are, how are we doing? What is the story behind the curve? Who are the partners who have a role to play in turning the curve? And what works to turn the curve? The final question is, what is our action plan to turn the curve? These 5 questions have implications within making equitable outcomes. The first question is, how are we doing? With achieving equitable outcomes, it's important to disaggregate the data for those diverse subpopulations that are a part of the whole population. Disaggregated data, what does it mean, first of all, to disaggregate the data? That means that you're breaking the data down into smaller groups by characteristics. That various demographics, when you look at the demographics of gender or race or ethnicity, you break down that data into smaller groups. It could be male, female, whatever is most relevant for the group that you're working with. The groups might be based upon gender, race, ethnicity, socioeconomic status, limited English proficiency, or other subpopulation characteristics. There are sometimes it's challenging to have data disaggregated at the community level. The hardest level is the neighborhood level, and that's a challenge oftentimes. I would like to give a recommendation for you for those who are looking for data, specifically around And a good example is with the Annie E. Casey Foundation's Kids Count data. They have a data center that maintains data on statistics for various areas of well-being for children, including educational, social, economic, and physical well-being of children. And the data center has numerous indicators for across the country, and I invite you to visit that as an example of what it looks like to have support from a foundation and their local partners in having disaggregated data. The local Center for Disease Control also has disaggregated data for the United States, and I know we have some others from different countries as well. And you can also search for data according to your federal partners who are responsible for distributing data. And then at the local level, you can advocate for neighborhood level data with partners and universities. We'll talk more about that later. But why is it important to disaggregate the data? You'll be able to better understand the outcomes for specific groups of people. It also illuminates the needs of smaller subpopulations that may be overlooked when considering only the aggregated data. And it helps to determine where targeted strategy development may be necessary. Keep in mind, disaggregating the data is not enough to achieve equitable outcomes. So simply having disaggregated data and then moving forward and doing a turn the curve with the whole population, the data alone is not enough. It's the first step, disaggregating it. You need to continue the work of understanding these subpopulations by answering each of the core turn the curve thinking questions to determine targeted strategies that will impact specific subpopulations. This is an example in Maryland with Maryland School Readiness. And the example is over the course of a decade from 2002 to 2012. As you can see, Maryland had the result, all children in Maryland enter kindergarten ready to succeed. And they used the indicator, the percent of children entering kindergarten ready to learn. Over the course of the decade, using results-based accountability, the percentage of children in 2002 went from 49% of children entering kindergarten ready to succeed to 82% of those kindergartners entering kindergarten in 2012 being ready to succeed. How did Maryland accomplish this? Well, one of the things that was that happened is that Maryland began to disaggregate the data by geographic region. And so Baltimore, who at the time had 28% of children entering kindergarten ready to succeed, Baltimore's result was specific to Baltimore's children. All children in Baltimore enter kindergarten ready to learn. By having this disaggregated data by geographic region, it enabled the leaders from each county and each geographic area to come together to consider the children in their neighborhoods, in their counties, and what the needs were for those specific subpopulations and groups. Maryland disaggregated the data by various distinctions: gender, race, ethnicity. They even had something that was pretty exciting, disaggregated data by prior care settings, and they continue to do this today. So they knew if children were coming from nursery school, public pre-K, child care centers, or even if they were with their family during those first 0 to 5 years and before they came to kindergarten. They understood if they were English language learners, and they also had disaggregated data by free and reduced meal program. So you can see by having a report such as this and understanding the data for each of these subpopulations, it enables the partners to come together and to consider those specific individuals and what their needs are. I'll give you another example about disaggregated data. In San Francisco's Unified School District, they've been tracking high school graduation rates, and they disaggregated the data by subgroups, including Latino, African Americans, Filipino, Asian, White, and Pacific Islander. These were the subgroups that were by ethnicity that were relevant for this San Francisco Unified School District. they began to look specifically at the high school graduation rate of African American students, and they even created a African American leadership initiative to focus in on improving graduation rates for this subpopulation of students. In 2009 to 2010, 56.9% of African Americans were graduating from high school at this time. And now the recent data in 2014 to 2015 showed dramatic improvements whereby 71.2% of African American students were graduating from high school. This disaggregation of the data enabled the school district, San Francisco Public School District, to use early warning indicators to identify students that needed extra support. So disaggregating the data is an important tool, and it's an important first step in order to understand the populations that need to be served and also to identify the needs of each population. So that's a little bit about how are we doing and the importance of disaggregated data. The next question is, what is the story behind the curve? When looking at the story behind the curve, one way of understanding the story is by doing a force field analysis. And in a force field analysis, you want to identify the positive and negative factors that tell the story behind the curve. What factors have contributed to improvement of the data? And what factors have been barriers to improvement of the data? This force field analysis is, when you're considering equitable outcomes, these are a few things that you want to consider. Understand, by disaggregating the data and then doing the story behind the curve for each of the subpopulations, you can look at and develop a story that is clear for each subpopulation and identifies the needs. The first step to think about is when you're looking at subpopulations whose success is not as evident as others, or you're seeing in the data that the success is not there, there's an achievement gap using the language of education, you want to develop the story starting with a strengths-based approach. It's easy for groups to come in conversation and to talk about why things are not going well with a group when you're seeing disparities, but you want to start with a strength-based approach. And I also include not to stop at the strengths. Sometimes, just as people can get caught up in talking about barriers, it's also sometimes easy to get caught up in talking about strengths and only look at the successful cases. But you want to have a balanced approach to developing the story. Use a strength-based approach, but also include the historical challenges that have existed and the story behind the data. Be open and transparent about the circumstances that have existed for individual subpopulations. These are difficult, sometimes difficult conversations, but they're important conversations to have about what's actually happening with this group. After you've had a conversation about the story and developed several conversations really, and you've developed a good understanding of the story, you want to begin to prioritize the factors to see what are the most important factors to address, and ensure that these factors include the important areas that need to be addressed for each subpopulation, not only the largest majority population, but also those subgroups. Ensure that the prioritized factors are addressing their interests and needs as well. Keep in mind with the story behind the curve that it must include the voice of those with the lived experience who are impacted by the decision making. They should be in leadership and they should be at the table from the beginning. I'm going to pause for a moment here and ask Eileen if you have a few ideas that the group has shared about engaging individuals with the lived experience.
Hi, Deidre. Yeah, we had several answers. The most common answer is community meetings, where they've brought people from the community in to ask them their opinions, to get feedback from them before they design, in one example, a better food pantry for the community. There's a community that offers stipends for time, childcare, and then to make sure the materials are translated and that they have interpreters there. And then one also said equal board representation.
Okay, thank you. Thank you very much. So equal board representation. And this may be a challenge. And so an important idea is to how can you authentically engage those individuals who are on the board, and how can you authentically engage individuals in community meetings? I think it's part of the solution is to build the capacity of those individuals to understand and to engage as equal partners in the meetings. So thank you for sharing those examples, and don't feel like you have to stop sharing them. You can continue to share. I'll also mention that if you have any questions, you can include those in the chat box as well. We may not get to them today, but they will become a part of our conversation within our community of practice. So let's talk a little bit more about the story behind the curve. We spoke about a factor analysis, looking at those factors that improve the success and restrict the success within the result you're trying to achieve. You do want to look at also a root cause analysis and explicitly include the root causes that have historically prevented equitable outcomes. In practicing in community with RBA, there's frequently the question about, should we include structural racism? What can we do about that? Should we include poverty? What can we do about that? It's important to include the root causes. Structural racism is a cause of inequitable outcomes. Poverty is a cause of inequitable outcomes. So you certainly want to include in your story behind the curve the root causes that have prevented equitable outcomes. How have different forms of racism contributed to inequitable outcomes? What societal bias exists, and how is it manifested in your community? What does it look like? Unless that is shared as a part of the story, you won't be able to create solutions to address it. What community factors need to be considered that may be external to your organization or your sector? So you may be working in juvenile justice, but that doesn't mean that you don't want to consider housing stability in your community. So there are external factors that you also want to include. Other things that you want to look at: what is the role of power in the decision making within your communities? Who holds the power? How is power transferred? How do community members, where do they sit with power, and how is it shared amongst the community members, amongst the stakeholders? What is the access to healthcare like? Each of these areas that are listed here may not be a part of your organization or your sector's mission, but it's important to include it as a part of the root cause analysis that exists, so that you're taking into consideration the whole person in the community and not just the person, that portion of that person's life that your organization or your sector is working with. Who are partners with a role to play in advancing equitable outcomes? This part of the Turn the Curve question for today is going to look specifically around equity and looking at individuals with a lived experience. They certainly need to be brought into the process as early as possible. They can provide, for example, a deeper understanding of the story and the viability of possible solutions. Social justice organizations will help to build the capacity of stakeholders to understand the context and build the work together. You may have local universities and researchers that can help to support that gathering of disaggregated data. They can conduct research to deepen the understanding of the story behind the curve. And they can do a root cause analysis and understand more about what works. So these are all research and information agendas that local university and researchers can support. Philanthropic organizations, earlier I mentioned the Annie Casey Foundation with Kids Count, but various foundations in your community foundations as well as national foundations can support capacity building for collaborative work among resident leaders, individuals with the lived experience, and community-based organizations. So these are some examples that partners can play in achieving equitable outcomes. I'm sure you can think of more, and I invite you to include some of those in the chat as well. Some specific organizations or types of organizations that you work with to support the work of equity. The next question in the Turn the Curve process is what works? Do we know what would work to turn the curve? And that's phrased as a question. You want to go into this work not assuming that you already know what works. You want to go into the work asking the question, what would work to address what we now know about the story for each of our subpopulations? You want to consider research-based, low-cost, no-cost options, off-the-wall options, and you may need an information and research agenda. Do we know what would work to turn the curve? Within the context of equitable outcomes, what works ideas should evolve from individuals with the lived experience. Be open, again, going back to that dialogue, be open to consider ideas that may not seem feasible. Be open to considering ideas that you have perhaps tried before, because this what works conversation is an opportunity to put everything on the table. Everything on the table, especially ideas that evolve from individuals with a lived experience. When you're thinking about and considering evidence-based models, consider the population that received the intervention in that evidence-based model. Would this strategy work with the subpopulations that you would serve, or that are a part of the whole group that you're working with? How comparable are the individuals to the program that was the evidence-based model? Also consider, do you have the capacity to implement that in that evidence-based model? We'll talk about that a little more with feasibility. What works? Do you know what would work? What policy systems and environmental changes can be implemented in order to ensure longer-term success? Equitable outcomes require changes in policy, changes in system. And these types of what works strategies need to be a part of the conversation, and even if it's difficult, even if it's challenging. What information and research do we need to better understand what works within specific populations? This goes to the information and research agenda that I just referenced. Before the final strategies are selected, without assuming that the answers are there, what research do we need to do to understand if there are possible programs with similar populations that have been effective in other communities? The last step of the Turn the Curve process is the action plan. Now, what are some implications for equitable outcomes with an action plan? First of all, you want to prioritize your actions. What are the actions that we're going to move from what works? How can something go from we believe this will work to then actually going on an action plan? The first criteria for selecting an action plan is that it must address the priority root causes in the story behind the curve, with focused attention to the subpopulations. How are the strategies applicable for each of the populations that are within your whole population? Also, feasibility. This is what I referenced earlier. Is there local capacity for successful implementation? Is it feasible? Is it affordable? How often have evidence-based practices been brought into the community with local organizations before those organizations were equipped and prepared to implement those evidence-based practices? So take time to think of feasibility in each of these ways. Values. How do community members value the strategy? It might be valued by the stakeholders. It might be valued as an evidence-based practice. How are community members valuing it? Do they believe it will work to address what they know is happening? Individuals with a lived experience, how are they weighing in terms of valuing this strategy? And the last criteria with RBA is specificity. Is it specific enough to be implemented? So we summarize these as specificity, leverage, values, and reach. And when you look at these strategies, which strategies will best impact the subpopulation? You can rate each of those what works strategy ideas as high, medium, or low for each of the criteria that's listed. And whichever strategies come out with high in each of these criteria areas, those are the strategies that will be moved forward into your action plan, ensuring that those strategies are applicable for more than just the majority population, but also for each of the subpopulations. You may need to have specific targeted strategies that are just for that subpopulation. The last step is to share your turn the curve thinking. This is a very comprehensive action plan that you've created, and you want to share each step of the turn the curve thinking that you've done along with the individuals with the lived experience, along with your partners. Sharing your turn the curve thinking within your group makes your decision making clear and transparent. Sharing your turn the curve thinking with the public, you may not need to share all of the detail of what works, all of the detail of your story behind the curve, but you certainly want to share how are we doing, what is the story behind the curve in our community, including the story of those subpopulations, so that people who are reviewing it from the public view get a good grasp of who you are within your community, both the larger populations, the majority populations, the subpopulations, and those who are contributing. And then the last part of what you're sharing is your action plan. So you may share all of the steps, or you may share these 3 steps, these 3 answers to these 3 questions in a condensed public plan. I wanted to share an example with you of the New Zealand government procurement contract template. This contract is what New Zealand is using to bring together their results-based accountability application and implementation, starting at the population level down to the smallest unit or program. So they start with the outcome. When they're working with an agency, even though that agency is simply one agency and cannot change the well-being for the whole community, they still share in their contract what outcome do you contribute to as an agency or as an organization. They also share the indicator that that agency or organization contributes to. And then they name the service and they describe the service that that program or agency is implementing. And also, very relevant to this conversation, they share the client group that is being serviced by this provider. So they describe the clients, they have their age, their ethnicity, their location, or other factors as are appropriate for the subpopulation that they're serving. They also include performance measures, quantity, quality, and effect. Or in other words, how much did we do, how well did we do it, and is anyone better off? By including this information in the contract, it actually causes that provider to be accountable for servicing those subpopulations that they said they would serve. How well did they do it? How well did they serve those individuals who are of a certain age, ethnicity, or location, as was required by the funding? I felt like this was a good example to share of how to go from talk to action and then to measurable results for equitable outcomes. So let's take a moment and think about, after hearing about results-based accountabilities, turn the curve thinking, and these applications for equitable outcomes, where are you now? How are you doing at responding to the core questions for the subpopulations that are relevant to your work? Are you using disaggregated data? Are you really doing a factor analysis and a root cause analysis to deeply understand the root causes for subpopulations? When you think about partners, are you engaging individuals with a lived experience throughout the decision-making process? When you're looking at what works, how have you researched what works for the subpopulations that exist in your community? And lastly, when you create an action plan Have you used the specificity, leverage, values, and reach review of the strategies to determine and to ensure that they're the right ones for the subpopulations that you work with? I'm asking you to apply your knowledge based upon what we kind of spoke about today, thinking about where you are now. What will be the focus of your equity work as your next step? What will be the focus of your equity work as your next step, as an organization or as a collaborative or as a multi-sector group of partners? Will you focus more on using disaggregated data? Perhaps you haven't been able to disaggregate the data. I know that it's challenging to have disaggregated data at the small neighborhood level, but maybe that's your next step, is to really get that disaggregated data. Maybe your next step is to go back and look more deeply at understanding the root causes, including what is structural racism? What is institutional racism? How has poverty impacted our community in ways that we're not assuming, but we really understand? So look at each of these questions, and I'm going to ask you to consider, when you go to your next meeting, will you ask your partners, how are we engaging individuals with a lived experience? I know we do focus groups, but how do we engage them at all levels of our organization, all levels of our collaborative, all levels of our working group? Perhaps you recognize after today, you have like a reminder and you're like, wow, we really do need to go back and research what works for the Filipino population. We really do need to look at, wait a minute, we've had some people that have been absent because I'll mention that in some communities, absenteeism for a funeral, families might take their children out of school for 2 weeks. And they're being considered, disciplinary action is taken up on them because within their culture, it's the norm to be away from school for 2 weeks when a family member has passed away. So what would it look like to research what would work to address that? Perhaps there needs to be more work with you and your partners around understanding what works for relevant subpopulations. Or the fifth question, maybe in your action plan, you want to go back and look at, is it specific enough to be implemented within our subpopulations? Do we know what it takes? Does it have, is it addressing what we know is necessary for our subpopulations? Is it valued by these subpopulations? And is it feasible and affordable? Is our action plan doable? So when you think about each of these 5 questions, what will you take to your next meeting? This is where I'm asking you to move from talk to action. In your next meeting, review your plan using the turn the curve thinking for achieving equitable outcomes. And I challenge you to make the changes that are needed. On your agenda, perhaps you're going to look at new data on how you're doing, or new information, or new partners, or new information on what would work. Or maybe you're going to recommend some strategy changes. Where are you now in terms of what you would take as a conversation to your next meeting? We're going to pause for a moment, and Eileen is going to share a poll with you, and we're going to ask you to answer it individually. Eileen, if you can share with us when we're just at about 80% or what our percentages are. Thank you for participating in our poll. And Eileen, I'm inviting you to share the results of the poll as you're ready to do so.
Okay. Can you see the answers I have there on the screen?
I cannot.
Okay. Okay. Sometimes they show up. Okay. 30% said they would disaggregate the data. 15% would deepen our understanding of the story behind the curve. 32% integrating those with lived experience into the process. 15% researching what works for subpopulations, and 9% said they would use the SVLR review of strategies. Are they the right ones?
Okay, thank you very much. And thank you everyone for participating in our poll. It's very helpful for us to understand where we are as partners working together toward equitable outcomes. As partners working together, I also want to share with you some approaches and resources that would be helpful for you, that I believe will be helpful for you. You may be familiar with asset-based community development. One of our consultants, Dan Duncan, is a facilitator of this method and methodology and framework, and it has written some papers and has even done a webinar around it. So we invite you to come to our website and find out more about asset-based community development as it relates to equitable outcomes. Community-based participatory research is a research method and evaluation method that also aligns well with achieving equitable outcomes with RBA. There are two philanthropic organizations that I'm going to mention that we often have partnered with. The Annie E. Casey Foundation, I've mentioned already. The Kellogg Foundation has done tremendous work around racial healing, around equity, and I invite you to visit their websites as well. Policy Link, I mentioned their definitions, they're partners with us. We work with them as well. The Race and Equity Institute. I'm also mentioning, because today we focused on education, the U.S. Department of Education has an Office of Civil Rights that has data available for schools and school districts. Now, at the individual level, I'm inviting you to take an implicit association test if you haven't done it already. This is for you as a person. It looks at your individual attitudes and beliefs around different groups. And so I invite you to think about that and to consider that as well. Courtney, I'll invite you to talk a little bit about after the survey and what we're inviting the participants to do.
Just as a reminder, I'd like you all to please take a moment and complete that survey. The survey should actually have made it to your inbox already. That survey will allow you to provide some feedback on your webinar experience. Also, by completing that survey, you'll also be provided access to the PowerPoint slides, as well as access to the webinar recording. Also,
go ahead, I'm sorry.
Also, if you plan on sharing this information, the citations are below for Dichi's PowerPoint material.
Thank you. We'll remind you, we probably have, I'm trying to see, we have about 5 minutes. Maybe we have time for 1 or 2 questions. I don't know if we had any questions that came in, Eileen.
Yes. Sorry, okay. There was one question from New Zealand. New Zealand has good methods of identifying factors contributing to inequity and the solutions around it. Are there other models that you would recommend? The model that they talk about is Mason-Dury. Do you have other models you'd recommend on identifying factors contributing to inequity?
Yes, there are various models that you can use in terms of doing the root cause analysis. I'm not familiar with the model that you've mentioned, but some of the models that we use that align nicely with the turn the curve, I've seen organizations use the fishbone analysis, and I've also have found the 5 whys to be very helpful as a way of understanding more deeply the story behind the data.
Okay, and actually that person also from New Zealand did make a comment that I thought I'd like to share with you, that
Certainly, thank you.
The model that you gave that's being used in New Zealand he said is not being used in government in the healthcare sector right now, and that's the only sector
Okay.
not using it.
Oh, thank you for that information. That's very helpful. Thank you. For the participant that shared that. So we are just about out of time. I do want to remind you about our Measurable Impact Conference, Mobilizing for Equity and Results. We will have a racial equity community of practice on November the 10th from 2 o'clock to 4 o'clock in San Antonio. It's not too late to register and to join us. And this is we're moving into the community of practice model in terms of bringing together practitioners, not just for conversation, but toward results. Because we are RBA practitioners, our conversations will be around communities of accomplishment, as someone recently shared with me. So we invite you into these conversations. We invite you to the conference and to continue connecting with us through webinars and through local meetings as you're able to. Thanks so much, everyone, and we appreciate your joining us.
That's me. Shut it off. Kratz. Okay.